we've sort of come to realise over the recent years that people are really struggling with managing their health in the community. On top of that, we're seeing more recently that people are really struggling to access their GPs, their pharmacists, their dentists. With those access constraints, we thought, look, could we do something a bit different? Could we take healthcare professionals out into the community and meet people in the community and see them where they are? And from what we've seen so far, in just the first hour, we're seeing a huge amount of success. On the back of the pandemic, we've seen other health inequalities get worse, so isolation, loneliness, decreasing physical activity. But you don't necessarily need to see a GP to work out how you can become more physically active. There are ways where you can look after your health and not let those long-term conditions exacerbate. That's why the purpose of this event is to say, look, there's so much happening in your community. Come and have a look, see what's happening in your community. And then we've got GPs here who are able to order blood tests and do prescriptions. So if we can come to a setting where we can sort of mitigate those risks, those barriers, teach people how to use digital services, then they will enable themselves to have agency to access their own data, get appointments. So that's what we're trying to do here, bridge that gap.
So we know we can't do this alone. We will only achieve the level of change that we need by working alongside our VCS, our health and other partners. And today's clinic is a really good example of how this commitment to joint action is reaching into our communities to support our most underserved residents. This is a one-stop shop where they can access health support and alongside cost of living support, housing, employment guidance and digital support.
Great to be here today at the Community Pop-Up Clinic here at Waltham Forest Community Hub. Lovely to see so many groups coming together who are supporting our residents with any issues that they might have in terms of health or dentistry, giving them vaccinations if they need that, giving them information, advice and signposting onto relevant services.